Well, hello and welcome back to the College of Natural Health Sciences Bermuda, the induction prep course. This is week 8 of the functional anatomy course that we are teaching, and we only have 2 more weeks left after this one. So we are progressing quite nicely, and I trust that you are enjoying the course thus far. And this week we will be taking a look at the trunk. And this is Chapter 7 of the Functional Anatomy textbook. The learning objectives for today's lecture are to identify the main structures of the trunk, including the bones, joints, special structures, and deep and superficial muscles. We're going to label and palpate the major surface landmarks of the trunk. We're going to identify and demonstrate all actions of the trunk, including the movements available. We're going to identify and demonstrate passive and resisted range of motion of the trunk. We're going to draw, label, and palpate the deep and superficial muscles of the trunk and name their actions. Palpation should include the origin, insertion, muscle belly, and demonstration of shortening and lengthening of muscles. We're going to describe the function of each of the muscles of the trunk. We're going to identify both the synergists and antagonists involved in each movement of the trunk, such as flexion and extension, for example. We're going to identify movements and muscles involved in coordinated activities of the trunk, such as pushing, lifting, bending, twisting. We begin today's lecture with a look at the surface anatomy of the trunk from an anterior view, beginning from the left-hand side. We see the pectoralis major, which dominates the superior and anterior trunk. Its primary actions are on the shoulder. The xiphoid process is a tiny diamond-shaped bone at the superior end of the sternum. Many muscles attach to the thick superior edge of the ilium, called the iliac crest. It marks the most inferior and lateral portion of the trunk. We can also see the umbilicus, which is also referred to as the navel or the belly button. From the right-hand side, we see the flat, vertically oriented sternum, and it is located in the depression between the right and left pectoralis major. The rectus abdominis is a paired superficial muscle that extends from the anterior ribcage to the pubic region. The linea alba segments the fibers of the rectus abdominis vertically. It runs from the xiphoid process to the pubic symphysis and marks the midline of the anterior trunk. The obliquely angled inguinal ligament is the inferior border of the aponeurosis of the external oblique muscle. Continuing with our look at surface anatomy of the trunk from an anterolateral view, we see the pectoralis major and the rectus abdominis. The external oblique is a lateral muscle of the trunk that ends anteriorly in a broad aponeurosis. The anterior superior iliac spine is the blunt anterior end of the iliac crest. Continuing with our look at surface anatomy of the trunk from a posterior view, on the left-hand side we see the upper, middle, and lower trapezius muscle. We also see the latissimus dorsi, which is a broad, flat muscle of the inferior posterior trunk. We can also see the thoracolumbar aponeurosis, which extends laterally from the spinous processes, forming a thin covering for the deep thoracic muscles and a thick covering for the muscles of the lumbar region. On the right-hand side, we can see the scapula, and we can also see the laminar groove, which is a furrow of either side of the spine. It marks the medial edge of the erector spinae group of muscles. We can see the posterior iliac crest, and we can also see the sacrum bone. The sacrum is a fused triangular inferior bone to the lumbar spine. Now let's consider the bones of the trunk from an anterior view. Beginning from the left most superiorly, we see the sternum and the costal cartilage. The slightly mobile sternocostal joints are formed by the articulation of the sternum and ribs. Flexibility here allows the ribcage to expand and recoil during breathing. We can also see the xiphoid process, the transverse processes of the vertebrae, and the iliac crest. We also see the 5 fused bones of the sacrum. On the right-hand side, we see the true ribs, which are ribs 1 through 7, and they articulate via the costal cartilage directly with the sternum. The false ribs, which are ribs 8 through 10, do not articulate directly with the sternum. The intervertebral joints are formed by the adjacent vertebrae and separated by the intervertebral joints. The 3 fused bones which form the pelvic girdle and the inferior border of the trunk are the ilium, the pubis, and the ischium. The pubic symphysis is the midline joint between the 2 pubic bones. And here we have the bones of the trunk illustrated from a posterior view. On the left-hand side most superiorly, we see the scapula. The costal vertebral joints are articulations between the ribs and the vertebrae. Ribs 11 through 12 have no anterior connection, and thus they are called floating ribs. We can also see the sacrum, and we see the coccyx, which consists of 3 to 4 fused bones. On the left-hand side, we see the true ribs. We see the false ribs. We also see the sacrum. The sacrum of the axial skeleton articulates with the ilium of the pelvic girdle at the sacroiliac joint. We also see the bones of the pelvic girdle. And now let's consider the bones of the trunk from a lateral view. We can see the 7 cervical vertebrae. There are 12 thoracic vertebrae. The scapula, which lies on the posterior trunk and forms a false joint with the posterior rib cage, is also illustrated. There are 5 lumbar vertebrae. We can also see the sacrum. We can also see the coccyx or tailbone, and it is the most inferior point of the axial skeleton. We can also see the ischium. On the right-hand side, we see the clavicle. We also see the sternum. The sternum is an anterior medial articulation point for the true ribs. We see the xiphoid process, and of course we can see the ribs. The ilium is also visible, as well as the pubis. And now let's consider the bony landmarks that we can palpate on the trunk. The anterior ribs, the xiphoid process of the sternum, the iliac crest, the pubis, the posterior ribs, the spinous processes, the laminar groove, the 12th rib, the transverse processes, the posterior superior iliac spine, the palpating sacral spinous tubercles, and the sacral crest. And now let's consider the ligaments of the trunk from an anterior view. The ligamentum flavum connects adjacent vertebral foramen. These ligaments limit flexion and help the spinal column return to an upright position. The anterior longitudinal ligament runs vertically along the spine from the cervical to sacral regions. The intertransverse ligaments connect the adjacent transverse processes and limit lateral flexion of the spine. The posterior longitudinal ligament is a narrow vertical band that runs along the posterior aspect of the vertebral bodies, attaching to each intervertebral disc. Now let's consider the ligaments of the trunk from a lateral view. Beginning from the left-hand side, we see the posterior longitudinal ligament and the ligamentum flavum. A network of interspinous and supraspinous ligaments connects one spinous process to another and limits spinal flexion. The supraspinous ligament is a continuation of the nuchal ligament found in the cervical spine. Over to the right-hand side, we see the anterior longitudinal ligament. Now let's consider the ligaments of the trunk from a posterior view. On the left-hand side, we see the superior costotransverse ligament, which helps stabilize the costovertebral joints. The lateral costotransverse ligament helps stabilize the costotransverse and costovertebral joints. On the right-hand side, we see the posterior longitudinal ligament. The posterior longitudinal ligament is deep to the spinal cord and surrounding dura. And here we see illustrated the ligaments of the trunk from a superior view. The lateral costotransverse ligament helps stabilize the costotransverse joint. The radiate ligament works with the costotransverse ligament to stabilize the costovertebral joint and maintain the position of the rib within the ribcage. Now let's consider the lymphatic vessels and lymph nodes of the trunk. The right lymphatic duct collects lymph from the right side of the head, neck, and thorax, as well as the right upper extremity. The thoracic duct runs parallel to the spine and collects lymph from the left side of the body and the right side inferior to the diaphragm. The thoracic duct drains lymph into the left internal jugular vein and subclavian vein. The cisterna chyli is an enlargement of the thoracic duct. It collects lymph from the intestinal and lumbar lymphatic trunks. Now let's consider the major blood vessels of the trunk from an anterior view. Beginning from the left-hand side most superiorly, we see the superior vena cava. The superior vena cava drains blood from the head, neck, and upper extremities. The inferior vena cava drains the digestive organs, pelvic region, and lower extremities. The superior mesenteric artery serves the majority of the small intestine and parts of the colon. The femoral veins become the external iliac veins and drain blood from the lower extremities. The subclavian blood vessels are deep to the clavicles and have many branches serving the head, neck, thorax, and upper extremity. The aorta is the largest artery in the body. It begins at the heart and descends into the abdomen. The external iliac arteries become the femoral arteries inferior to the inguinal ligament. They are the major arteries of the lower extremities. Now let's consider the nerves of the trunk from an anterior view. The splanchnic nerves arise in the thorax but descend to innervate the abdomen. The hepatic plexus is a large unpaired group of nerves innervating the liver. The lumbar plexus lies anteriorly in the pelvis and passes in front of the coxal joint. It mainly innervates the anterior thigh. The sacral plexus lies posteriorly in the pelvis and innervates parts of the pelvis, the posterior thigh, most of the lower leg, and the entire foot. The superior gluteal nerve innervates the gluteus medius, the gluteus minimus, and the tensa fascia lata. The inferior gluteal nerve innervates the gluteus maximus muscle. The sciatic nerve originates near the ischium and descends into the lower extremity. And here we see illustrated the nerves of the trunk from a posterior view. Of particular note is the cauda equina. It is the terminal branching of the spinal cord, and it is also referred to as the horse's tail. The intercostal nerves supply the intercostal muscles and the abdominal wall inferior to the ribcage. Now let's identify the superficial muscles of the trunk from an anterior view. We see the sternocleidomastoid, the deltoid, the pectoralis major, the latissimus dorsi, the serratus anterior, the external oblique, and the abdominal fascia. Now we have a posterior view of the superficial muscles of the trunk, beginning with the trapezius and the latissimus dorsi. The intermediate muscles of the trunk from an anterior view are the intercostals, the serratus anterior, the abdominal fascia, and the internal obliques. Now let's identify the intermediate muscles of the trunk from a posterior view. Beginning from the left, most superiorly, we see the rhomboids minor and major. We also see the intercostals, and we also see the external oblique. Over to the right, most superiorly, we see the longissimus. We also see the spinalis. We also see the longissimus again. We also see the iliocostalis, and we see the thoracolumbar aponeurosis. Now let's identify the deep muscles of the trunk from an anterior view, beginning with the external intercostals. We also see the internal intercostals. We see the pectoralis minor, the coracobrachialis, the serratus anterior, the rectus abdominis, and the transverse abdominis. Now let's consider the deep muscles of the trunk from a posterior view. Beginning from the left, most superiorly, we see the semispinalis capitis, we see the levatorus costarum, we see the semispinalis thoracis, and we see the multifidus. Over to the right, we see the intertransversarii surfaces, and we see the rotatories thoraces. And here we have the muscles of breathing illustrated from an anterior view. Over to the left-hand side at the very top, we see the sternocleidomastoid. We see the scalenes, the serratus anterior, the external intercostals, and the diaphragm. Over to the right, beginning at the superior, we see the internal intercostals, the transversus thoracis, the external oblique, the internal oblique, and the rectus abdominis. Now let's identify the general techniques used for palpating muscles in the trunk region. We first locate the origin, then we locate the insertion, We also locate the muscle belly. We activate the muscle using resistance. We shorten the muscle, and we lengthen the muscle. And this illustration shows the muscle attachments of the trunk from a superior view. And here we see illustrated muscle attachments for a thoracic vertebra from a posterior view. Now let's identify the motions that are available at the trunk. Diagram A illustrates trunk flexion. Diagram B illustrates trunk extension. Diagram C illustrates lateral flexion to the right. Diagram D illustrates lateral flexion to the left. Diagram E illustrates trunk rotation to the right. And diagram F illustrates trunk rotation to the left. Now let's consider the motions available for breathing. In diagram A, we see inhalation. In diagram B, we see exhalation. The purpose of resisted range of motion is that it helps to establish the health and function of dynamic stabilizers and prime movers in this region. It helps to identify balance and potential imbalance between the muscles that move and stabilize the spine and the axial skeleton. Passive range of motion is not assessed for this region because it is not practical or safe. Now let's consider how the therapist will demonstrate resisted range of motion of the trunk. In diagram A, we see resisted flexion demonstrated. Diagram B, resisted extension. Diagram C, resisted lateral flexion to the right. Diagram D, resisted lateral flexion to the left. Diagram E, resisted rotation to the right. And diagram F, resisted rotation to the left. And here we see resisted inhalation being demonstrated. Diagram A shows resisted inhalation of the upper rib cage, while diagram B shows resisted inhalation of the lower rib cage. Now let us consider the synergists and the antagonists of the trunk. For the synergists, we have flexion, the rectus abdominis, the external oblique, and the internal oblique. For the antagonists, we have extension, which is the iliocostalis, the longissimus, the spinalis, the quadratus lumborum, the semispinalis, the rotatories, the multifidi, and the interspinalis. The synergist muscles for lateral flexion of the right include the right rectus abdominis, the right external oblique, the right internal oblique, the right iliocostalis, the right longissimus, the right quadratus lumborum, and the right intertransversari. The antagonists for lateral flexion to the left include the left rectus abdominis, the left external oblique, the left internal oblique, the left iliocostalis, the left longissimus, the left quadratus lumborum, and the left intertransversari. Synergists for rotation to the right include the right external oblique, the left internal oblique, the left semispinalis, the left multifidi, and the left rotatories. Antagonists for rotation to the left include the left external oblique, the right internal oblique, the right semispinalis, the right multifidi, and the right rotatories. Now let's consider the synergists and antagonists for breathing. For inhalation, we have the diaphragm, the external intercostals, the serratus posterior superior, the levator costarum, the quadratus lumborum, the scalenes, the pectoralis minor, and the serratus anterior. For exhalation, we have the internal intercostals, the serratus posterior inferior, the transverse abdominis, the internal oblique, the external oblique, the rectus abdominis, the subcostalis, and the transverse thoracis. Now let's consider the coordinated movements of the trunk. The abdominal muscles are capable of powerful forward movements of the trunk. The arms and trunk flexors work together when pushing anteriorly and overhead, such as with this throwing motion. The coordinated movement demonstrated here is lifting. Maintaining erect posture and reestablishing this posture after bending is a primary function of the trunk extensors. The erector spinae group is a main contributor to this function, particularly when carrying or moving loads in the front of the body. The coordinated movement demonstrated here is bending. The lateral flexors of the trunk are active when bending toward one side of the body. Deep stabilizers, such as the quadratus lumborum and the erector spinae muscles, maintain posture while the abdominals power the movements of bending to the side. And the coordinated movement demonstrated here is twisting. Rotational movements, such as throwing, require coordination of deep spinal stabilizers and superficial prime movers of rotation. The rotatories and multifidi groups maintain spinal alignment while the obliques turn the body and generate force in the trunk. So to summarize the main points from today's lecture, the bones of the trunk include the thorax and the lumbar vertebrae, the sacrum and coccyx, the 12 ribs, the sternum, and the paired ilium, ischium, and pubis. The ribcage contains anterior costal sternal joints and posterior costal vertebral joints, while the spinal column consists of overlapping intervertebral joints. The spinal column has 4 curved divisions: the lordotic cervical spine, the kyphotic thoracic spine, the lordotic lumbar spine, and the kyphotic sacral region. Each spinal division has unique bony and soft tissue features that regulate mobility and function. Deep muscles, such as the rotatories and the multifidi, stabilize spinal segments, while large superficial muscles like the obliques and erector spinae powerfully move the trunk. Complex networks of nerves branch from the spinal cord and form plexuses in the trunk. Trunk bones and muscles are nourished and drained by circulatory and lymphatic vessels. Movements available in the trunk include flexion, extension, lateral flexion, and rotation. The motions responsible for inhalation and exhalation occur in the trunk and are controlled mainly by the diaphragm, intercostals, and abdominals. Coordinated movement of the trunk muscles creates smooth, efficient motions such as pushing, lifting, bending, and twisting. So for our assignment for this week, assignment number 7 for week 8, we're going to list the bones of the trunk. We're going to list the superficial, intermediate, and deep muscles of the trunk. We're going to list the movements available at the rib cage. We're going to list the movements that are available at the lower trunk. We're going to list the techniques used for palpating muscles, and we're going to state the purpose of assessing resisted range of motion at the rib cage and at the trunk. Don't forget to leave a comment at the bottom of this video, and also please leave a posting at the discussion page for this channel. And I look forward to receiving your assignments, and do have the rest of a good week.